today's town hall. We've had numerous town halls across the state in person, but I thought it was important for us to do it during this moment when the government is shut down, to reach each other at least virtually, if not in person. And I want to thank all of you for your incredible interest. Over 1,000 Coloradans RSVP'd to this event, and we've received over 200 questions. Usually in my regular town halls, they're just I call on people and they ask their questions. There's no ability to screen or anything else. I want to assure you we didn't screen them either in this context, except just based on what were the most frequently asked questions. And I'm going to answer as many of those as I can. I want to share an update on where things stand in Washington. We're now on day 21 of the government shutdown, and Republicans are so far allowed to refuse a vote on our proposal to permanently extend critically important Affordable Care Act tax credits. And that's very unfortunate because insurance marketplace shopping, as many of you know, began 2 weeks ago in Colorado. Open enrollment starts on November 1st, and Coloradans are already receiving notices from their insurance providers that their premiums are set to skyrocket. That is unnecessary, and it should not be happening. But that skyrocketing will be by nearly as much as 300% in some parts of the state. Across Colorado, even before this health insurance crisis that was provoked by President Trump, working families are already struggling with an affordability crisis. The median home price in our state is now $640,000. Childcare is the fourth most important, most expensive in the country, costing families an average of $22,000. We have one of the highest personal debt to income ratios in the country, which means that many folks can't afford to live in Colorado anymore. And now we have the chance just to make life a little bit easier if we could get Republicans to work with Democrats to extend these tax credits and help small business owners and working families make ends meet. Nearly 80% of Americans, without respect to party, support extending these credits. They understand that without them, many families will no longer be able to afford health insurance and be forced to make an impossible choice that unfortunately too many families in America have to make, which is to seek care or go without. We need to extend these health care credits, and we need to open the government. Last week, I hosted a roundtable with federal workers from all over Colorado. They deserve our thanks. They deserve our gratitude. And on this call, all of them expressed how challenging their work has become, not just over the last few weeks, but over the past year. They described endless uncertainty as this administration has threatened them, has threatened to fire them, to cut their pay, when all they want to do is work on behalf of the American people. And even though they're being forced to work without pay right now, or in some cases have been furloughed, they expressed how important it is to stand up for the health care of Americans and to try to bring this to a successful conclusion. And that is my hope as well. I think that we need to get to an agreement. We need to get the government open again, but not before we've made it clear that Americans' healthcare costs are not going to go up. I know this is a time of incredible uncertainty, whether you are a federal worker or a service member, a retiree concerned about Social Security and Medicare benefits, or someone who is wondering how the shutdown will affect your travel plans. While we navigate this uncertain time, my offices remain fully open. We continue to process casework with open agencies. My website's been updated with a shutdown resource page detailing services that remain available and where Coloradans can expect disruptions where services are not available. Please visit bennet.senate.gov if you have questions, and we will continue updating the page as we receive guidance from federal agencies. So I look forward to taking your questions. And as I said, we summarized the most common ones. So then the question was, how are we going to get those to be asked? Because I thought it would be ridiculous if I asked the questions and then answered the questions. So I have imposed on one of my really amazing people, Hillary Henry, who helps lead my team on the Western Slope. She's from the Western Slope of Colorado. She works in our Grand Junction office and or has for a long time and works all over the West Slope on public lands issues and other issues. And she, for reasons I'm not entirely sure, said she'd be willing to do this. And I want to say thank you to her. Thank you on behalf of my entire staff who also are working without pay at this point. Hillary, thank you for your public service and your willingness to be here today. And if you'd be willing just to start at the top and work your way down, I'll answer as many questions as we can. So Hillary, please take it away.
Thanks, Michael. Your first question this afternoon is from Derek, a furloughed federal scientist. He wants to know, how do we end the shutdown?
I think that first of all, I think we should be hoping that we can get to a conclusion here soon and to an agreement here soon. We've been having conversations among senators about the looming health insurance crisis, which is not red or blue. Americans in every state are facing massive premium hikes, and I think that is. I think there are people on the Republican side of the aisle in the Senate, at least, that are aware of that. It's a little harder to know what's going on in the House because those guys have literally been gone for an entire month. They have not come back. I'm in DC today as we have this conversation because the Senate has continued to have votes. But Republicans control the House and the Senate and the White House, and obviously this can't be reopened without the approval of President Trump, who holds the keys on the Republican side. And so what we are doing is making the case as strongly as we can with our colleagues here in the Senate and with people at the White House that they've got to figure out how to address these healthcare tax credits, and they need to do it fast because the November 1st deadline to extend the credits is on top of us. And I am hopeful that my Republican colleagues will come to the table and help us all find a solution. We're going to keep pushing until that happens.
Our next question is from Kim, a retiree. She is worried about the shutdown impacting Social Security and Medicare benefits. Will a prolonged shutdown prevent her from receiving Social Security and Medicare payments?
I appreciate that, Kim. That is a question that I've gotten over and over and over again during the shutdown. Many people have worried about it. And the answer is Social Security and Medicare payments continue as normal, even in the event of a government shutdown. You should not see a disruption in your payments, even if the shutdown continues and is prolonged. If you do see a disruption in your usual Social Security and Medicare payments, please call my office right away. I'm going to read this number a few times today, but if you've got a pen, 303-455-7600. That's 303-455-7600. We're happy to take anybody's questions, but particularly if you see a disruption of your Social Security or Medicare payments. But as I said, they are supposed to continue, and they have continued during this shutdown.
Up next, we have a question from Mary Jane. Her family received an estimate for their 2026 insurance premiums. The new costs are literally unaffordable for her family. What happens if Republicans do not extend the ACA tax credits?
I can't imagine, Mary Jane, how stressful this must be for you. And I am grateful for those of you, because it came from not just you, but others as well, for sharing your story. It's a problem that people all over Colorado are facing. In some parts of the state, monthly premiums are set to increase by nearly 300%. And it is for families just like you that we are holding the line here to use all the leverage that we have to draw attention to this looming healthcare crisis. As more and more people across the country receive notices like yours, I am hopeful that my Republican colleagues are going to understand the extent of this crisis and come to the table to work on a solution. I just felt that it was not responsible for me to vote for President Trump's budget if he didn't address this particular challenge, because it is so predictable. I might say, by the way, in addition, just that we're having this debate right now on these unaffordable credits for insurance that frankly is not providing people what they need. I had a young woman from Gunnison asked me the other day, who had graduated from Western there and was coming off her parents' health insurance in a year. And she said, "What am I supposed to do? Take 2 or 3 jobs to pay for this insurance that has this massive deductible and doesn't even cover what I'm going to need to do?" And that's a question more and more Americans are asking. And I think that we need to get to a place here where we have universal health care in this country, just like every other industrialized country in the world. That's not going to happen in the moment with Donald Trump as our president. It's not going to happen when all we're trying to do is not make matters worse when it comes to buying private insurance for Mary Jane's costs to go up even more. And in the meantime, in the short term, that's what we have to prevent. In the long term, I think we should have a healthcare system that costs half of what ours does and delivers better outcomes both in physical health and mental health. Hillary,
Thanks, Michael.
thank
Our
you.
fourth question is from Melanie, who wants to know what you are doing to stand up for federal workers who have been treated horribly this year.
Thank you very much, Melanie, for that. And let me say, I'm sure there are a lot of federal employees on this call. Thank you so much for your service. Colorado is home to more than 40,000 federal employees, and they have been targets of this administration since day one for just for doing their job. As I mentioned earlier, just last week, I held a listening session for federal workers across Colorado, and their stories are truly devastating. Many have described a culture of fear, especially at the CDC. There are people who feel like they can't even have a telephone conversation without fear that it's being overheard and that they will be recriminated against for the conversations that they are having. IRS and Social Security staffing levels are the lowest they've been in decades. And consistently low staffing levels have very real implications for Coloradans. People can't get home loans processed or benefit eligibility verified. Just today, I had the chance to vote on a bill that was addressing is trying to address the forestry issues that we have as a state, but in the Western United States, but that has no money attached to it and is not restoring the staff that has been let go by the administration in the Forest Service. It's so critical to our ability to protect ourselves in Colorado. And over and over again, federal workers have just stressed to me that they just want to do their work. And I hope that we will all be a voice for Colorado's federal workforce during these challenging times. I've held multiple town halls and listening sessions to connect federal workers with resources, answer their questions, and listen to their stories. My website has a designated resource page. If you're a federal employee, you can go there to learn more about your rights and available resources. And if you are in need of assistance, please contact my office if you're a federal employee. We're here to help in any way we can. That number again is 303-455-7600. And I want to say, as the child or of a federal employee myself, I just want to say how deeply grateful I am for the work of Colorado's dedicated public servants, what they do every day, and the way they do it. You have the admiration of all the rest of us. So thank you for doing that.
Up next, Michael, Bob is concerned about blatant Hatch Act violations by the Trump administration. Specifically, the political out of office messages employees were asked to post and messages on federal websites blaming Democrats for the government shutdown.
You know that I thought I'd seen it all before I saw that, but that it just demonstrates that no the sort of the meanness of all this knows no bounds. And I with a group of 21, I guess it was 22 of my Democratic colleagues in the Senate, we demanded that the Trump administration immediately remove these partisan political messages from federal websites. It's an outrage. And you're right, it is a clear violation of the Hatch Act. And we have to keep pushing back, as with so many things, against the Trump administration and holding them accountable. Hillary?
Next, we'll turn to a question from Jim. He wants to know if there is a bill that bans members of Congress from receiving pay during a government shutdown.
That is a great question, Jim. I believe that members of Congress should not get paid if we fail to pass a budget. I've long had a bill that said that, and I've asked that my salary be withheld during the entirety of this shutdown, as I always have during every shutdown that I have been part of. And when the shutdown ends, I plan to donate my salary to groups in Colorado who are serving people there, as I always have. And I just think there is, if we're going to go through a shutdown like this and people like Hillary and other federal employees are going to not get paid, the least members of Congress can do is not take their pay.
Craig feels like both sides have spent the shutdown blaming each other. Are there any real conversations or negotiations to end the shutdown happening in Congress right now?
I think the thing that discourages me the most about that, Craig, is that the Speaker of the House, Mike Johnson, recessed it. Now I think it's been for the third week in a row. So the House of Representatives has not even been in Washington for a month to negotiate a deal on health care. I mean, however you feel about which party is to blame, it is hard for me to see how Mike Johnson doesn't deserve anything but blame if he's going to recess his House for a month and not bring it back, to have discussions, to have negotiations, to hope that somebody has a better idea. In the meantime, there are some conversations going on. We see each other every day because we're continuing to vote. When I say we, I mean Republicans and Democrats in the Senate, and we're discussing the healthcare issues that I talked about at the very beginning of this negotiation or discussion. And I believe there are people on that side that want to figure out how to resolve this problem for the American people and reopen this government. But whether Donald Trump is one of those, we don't know yet. And how soon it's going to happen, we don't know that either. And that's a big issue because people are having to sign up. This is the window for people to be able to sign up for health insurance. And every day that goes by, people have less and less certainty about what their health care is going to cost. And that's why we really need to have a decision made right now. And some people say, well, let's push this off to the end of the year and we can make the decision then. That's going to be too late for the American people. And there's nothing's going to change between now and then. We know what the facts are. Let me make one last point about this too, which is that this is different from past shutdowns when those shutdowns were about taking health care away from the American people. It was about repealing Obamacare or some version of doing that. This is the exact opposite of that. We're trying to say, look, the notices are going out right now. We need the American people to know whether they're going to be able to have their costs of health insurance mitigated or defrayed if these tax credits are in the end going to be approved, and without them, their prices could go up 300 or 400%. That's a very different situation, and it's an urgent situation. It's not something that's going to get better with time, which is why I hope we, can find a way to stay here and get this done.
Michael, the next question is from Victoria. She wants to know why our tax dollars are being used on Trump's White House renovations when the federal government isn't even open.
It's amazing, Victoria. This was one of the most frequently asked questions, and I completely share your outrage about the demolitions of the East Wing of the White House. The White House does not belong to Donald Trump, and 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 in my view, he's not entitled to make these permanent differences on the most, one of the most iconic and important public buildings in America. And I do understand that taxpayer dollars are not being used for that White House in construction. I've been told that President Trump and his donors are paying for all this destruction and for his new dining hall or whatever it is that he's putting there. But this is the arrogance of somebody doing this. The White House is hard to fathom, and I have been one of the loudest voices in the Senate opposing the Trump family's corruption. I introduced and attached an amendment of mine to ban the president, his family, the vice president, any politicians in Washington from profiting off of crypto. And unfortunately, I'm sad to say my Republican colleagues blocked that amendment from even having a vote. This guy has made billions of dollars since he became president in his second term. And whether you're a Republican or whether you're a Democrat, I think we should want a president who not only isn't demolishing the White House for his own ballroom, but probably even more important than that, isn't making billions of dollars at a time when Americans can barely afford health care. And I'd like to have a president who would tell us that they're not going to steal a single penny, not going to make a single penny of outside money, or pardon their families for that matter, while they're in the White House. And I remain committed to holding President Trump accountable, as we should every president, for the values and principles that we care about, and vigorously using the power of congressional oversight to ensure that no tax dollars are used for his remodeling project. But as I said, that's not even the extent of it, because he shouldn't be doing it in any case, whether he's using his donors' money or his own money. I wouldn't bet on his own money. He shouldn't be doing it to begin with, but he surely shouldn't be using taxpayer money.
Michael, our last question is from Barbara. She's concerned that Democratic leadership is not being vocal enough about reining in Trump. How do you respond to her concerns?
Well, Barbara, I hear you. I definitely hear you on that, and I appreciate very much the calls that I get from people saying, good job, and also keep going. And this is an incredibly challenging time, and it is up to all of us, I think, especially Democrats in Congress, to do everything we can to fight back on this administration's abuses on behalf of the American people. I've been trying to do my part by leading the fight on Gabbard and Kennedy's nominations, by leading a fight against Besant and Greer, who are leading the charge on his harmful tariff policy by calling on Hegseth and Ratcliffe to resign after Signalgate. And by the way, now the latest from the Defense Department is that they're basically requiring every reporter who's there to essentially sign a loyalty oath. Totally undemocratic, un-American. I mentioned the fight that I've led on the crypto bill, and I frankly called out my own caucus in the Senate because they were supplying votes to pass that bill without restraining Donald Trump's ability to own that. And by the way, that's now changed his economic fortune to the tune of billions of dollars while he's been in office. We've never seen anything like this in America. And I've worked to fight for federal employees, especially at our public land agencies and our scientists and our veterans, and led the fight to try to get to a place where we can overturn Donald Trump's incoherent tariff policy, which is hurting small businesses all over Colorado, who are feeling like they had just recovered from COVID. They just recovered from their supply chains getting destroyed by COVID, and now their supply chains have been destroyed by a completely incoherent tariff policy. So, as I mentioned, we've done 14 in-person town halls across Colorado. We'll continue to do that so that we can listen to thousands of constituents. And we've got to, all of us, keep demanding accountability from our elected officials. We've got to keep paying attention. We've got to, which these, by the way, questions reflect, obviously that's what you're doing. We've got to keep showing up, and we've got to keep asking tough questions. And we can never give up hope. We cannot send a signal to our children that they should give up hope. America's battle has always been a battle from the very start between the highest ideals that have ever been written on the page, the words in the Constitution and the words in the Declaration of Independence, and the worst impulses in human history. And that's not a woke history of the United States. It is the history of the United States. And I think we should fight very hard to make sure that we end up on the side of the highest ideals and not the worst impulses. And when I say we, I mean all of us, this entire country. And that's why we have to fight to get to the other side of this moment that we're in today. And I want to say thank you to all of you, no matter what party you're in, no matter what your ideological beliefs are. I think that we can come together to agree that the president shouldn't be doing the kinds of things that he's doing, but in this moment in particular, that we should be able to reopen our government with the American people having assurance that they are going to be able to keep their insurance costs from doubling or tripling for no reason other than the inability of Washington to come to a solution. Please stay in contact with my office. I want to thank Hillary again for her willingness to help navigate this call. I deeply appreciate that, and we're here to help navigate during these uncertain times. Again, my office can be reached at 303-455-7600. My website is bennet.senate.gov, and there is a resource page there for federal workers and for those with questions about the ongoing shutdown. Thank you so much, all of you, for joining this call. Thank you for submitting your questions. Thank you for the folks whose names we read as we went through the questions. And I hope you'll reach out if you've got further questions. Thanks, everybody, for being here. Hillary, thank you for your public service, and I hope I'll see all of you soon in person.